Fearlessness and development. Now,
good evening, dignitaries on the dais, off the dais, and as those who would be working in the prevention field of HIV/AIDS, we would know that consistent condom usage, especially among regular and live-in partners, has been difficult, and therefore PrEP is a very important and critical component in our fight to control this epidemic. This being said, I think is evident by having our Honorable Minister Madam here. Madam, your presence, I think, not only represents the government of Andhra Pradesh, but also your personal commitment to marginalized communities, healthcare, and also the dynamism and courage to take up part. Extend a very warm welcome to the Honorable Minister. As I earlier said, that while the political will represents government machinery needs to be motivated, encouraged, and put in place. Example, then our PD APSACs, Shri Naveen Kumar, in a responsive, effective, and efficient delivery of healthcare services, I think not only in his HIV/AIDS sector. Sir, I wouldn't say warm welcome, but thank you for your support and encouragement model, and I'm sure that shortly we'll hear about the AP model. We would like to thank the principal.
పరిమళ భరిత పుష్పగుచ్చాలతోటి సత్కరించడం, ఒక షాల్ ఇవ్వడం, మనసులో ఉన్న ప్రేమను వ్యక్తం చేయడం. మనమైతే చప్పట్లు కొట్టేయచ్చు, చాలా సంతోషంగా ఇలాంటి ఎన్నో మంచి కార్యక్రమాలు మన కాలేజ్లో జరగాలి, మనలాంటి డాక్టర్స్కి ఉపయోగపడాలని కోరుకోవచ్చు, తప్పలేదు. సో దయచేసి ఈ అభినందనలో మనం కూడా పాలు పంచుకుందాం. గవర్నమెంట్ హాస్పిటల్ సూపరింటెండెంట్ మిసెస్ ప్రభావతి గారు, this is physician and a researcher for new diagnosis for tuberculosis. Now comprehensive prevention including PrEP in Prepare program. Welcome, ma'am.
Honorable Minister of Health and Medical Family Welfare, Ms. Vidadala. Naveen Kumar, Special Secretary, Project Director, AP SACS. Mr. V. Vinod Kumar, Commissioner, Project Director, AP SACS, Health Strengthening. Dr. Shobhani Rajan, Chief Medical Officer, DDG NACO. Mr. David Bridger, UNAIDS. And Dr. Joseph Williams, VHS. Friends and colleagues, on behalf of the United States Centers for Disease Control and Prevention and our PEPFAR team, I'm delighted and honored to be here. Comes out of Andhra Pradesh, and CDC, through our partner VHS, is privileged to work hand in hand with AP SACS, providers and community on expanding PrEP access as a robust part of prevention. Expand options for PrEP. And these innovations, as in the case of HIV treatment, were leveraged during COVID. We have to remember access, partnerships with communities, and working with community-based preferred providers.
There is no sound at all in between your hands. Please make a great round of applause. It's so wonderful. Everyone is very opening. With that. Thank you very much, ma'am, for the initiation of this. Is there, that is frequently asked questions booklet. We request the FAQ booklet. Thank you so much, ma'am. It's really a great honor that, and by the
Voting virtually, CM Monaco, who has joined the meeting, Sri Naveen Kumar, Special Secretary, Dr. Melissa Nindak, Director, CDC.
congratulations, Dr. Rasi and TB Control Officer, Mr. Srinivasan, Vice Principal, Sims College, Guntur, Ramarao, Principal, Chalpati Pharmacy College, Guntur, Sister Victoria Naristi, St. Joseph's Nursing College, Guntur, Network, Guntur, Mr. Lazarus.
Let me first acknowledge the excellent work carried out by Andhra Pradesh State's AIDS Control Society in scaling up the HIV response along the prevention to take care and treatment continuum. And happy to mention that we are closing the gaps in reaching epidemic control in Andhra Pradesh. As of July 2022, we have diagnosed 2,65,256 out of the estimated 3,13,725 PL HIVs in the state, and we have 48,469 remaining that needs to be diagnosed. Out of the 265, 2,812 on treatment, and we have 62,444 remaining that needs to be put up on the treatment. We need to work even hard and do more as we are entering the last mile to reach the remaining targets and achieve epidemic control. I'm also proud to say that Andhra Pradesh has piloted several innovative programs to enhance the HIV response. We have implemented index testing at scale, and this helped us fast-track HIV case finding and fidelity. NACO is keen to replicate the index testing program at national level and will do so soon. To improve access to the treatment, Andhra Pradesh led the way by demonstrating differentiated models of care such as multi-month ART drug dispensation, and this has been adapted by the national program. I would like to thank NACO for their support given to the state, and we implement programs in accordance with the national guidance. Besides, there is close collaboration between National AIDS Control Program and National Viral Hepatitis Control Program. When this invitation was extended for me inaugurating a vital prevention initiative of promoting PrEP, I really accepted. I accepted because this is a very important initiative of reaching out and providing prevention services to the people of Andhra Pradesh. I would like to express here that there is an urgency for us to prevent HIV among the key populations. The health of vulnerable key populations is equally important. I would like to say here that our dynamic Chief Minister Sri Y.S. Jagan Mohan Reddy Garu will ensure equitable access to prevention programs to the vulnerable key populations and will leave no one behind in the response. Here I would like to laud the efforts of voluntary health services who, with support from CDC, have done stellar work in bolstering the prevention efforts, especially among the vulnerable key populations. Their efforts on mainstreaming transgender healthcare in the government health system by establishing one-stop centers at the Government General Hospital is highly appreciable. This is the first time in the country that an initiate at this scale of providing comprehensive care for transgender and other key populations in the government hospitals has been carried out in Andhra Pradesh. I would also like to take a moment to thank CDC, Dr. Melissa and her team for their support to the state in scaling up the HIV response. As a health minister, the vulnerable communities are my biggest priority, not only in HIV, but all in health programs. Providing access to quality health care to all, and particularly the poorest of the poor families, is what we strive for, and we are making great progress in the state by achieving universal health coverage. Our Honorable Chief Minister, Sri Y.S. Jagan Mohan Reddy Garu, gives highest priority for the attainment of all the sustainable development goals. To achieve the sustainability development goals, our Honorable Chief Minister has taken governance to the doorstep of people, ensuring all the welfare schemes and health services reaches the most marginalized people, including the poor and the key population communities. In line with the vision of our Honorable Chief Minister, the ward and village secretariats were established. These acted as the one-stop shops for implementation of all the welfare development and health activities. Will ensure that the Gram Sachivalayam also reaches out the vulnerable key population communities and provide not only HIV and health, but also development services, as we want to improve the quality of life of these populations we are talking about. I would like to affirm that prevention will remain the mainstay, and it is fundamental to all our efforts in achieving epidemic control. The invention of pre-exposure prophylaxis as a biomedical tool is cornerstone of HIV prevention and in halting new HIV infections. Experts have firmly established that PrEP is extremely effective in reducing HIV acquisition, resulting in dramatic decreases in new HIV infections when implemented as a part of combination prevention strategy. Actions to prevent HIV. We need to capitalize on these invention. Will include PrEP as a part of the combination prevention strategy here in Andhra Pradesh. I would like to thank the National AIDS Control Organization for releasing guidelines on PrEP, and this will guide us in promoting PrEP in the state. Firstly, our biggest focus should be on increasing awareness of PrEP as a prevention choice and helping the client to decide whether PrEP is right for them. This is a theme which we have embarked upon today, PrEP awareness and reach out in Andhra Pradesh. And this is apt. Only when we create awareness among the high-risk communities, there will be a demand for PrEP. VHS are already begun creating awareness on PrEP, but we need to implement the PrEP awareness program at a scale. I would like to emphasize engaging the community in the PrEP awareness and in the implementation of intervention. The community-led HIV prevention services, including PrEP, will help to reach out the people and who need the most. Again, for PrEP to be successful, adherence is critical, and community are the best places to support in follow-up. Finally, I would like to assure that we will work towards addressing the social and legal barriers to HIV prevention services for the key and priority populations, as this impedes our progress towards achieving epidemic control. And in addressing the structural barriers, one of the landmark decisions that our government took and implemented is integrating transgender healthcare and the government health system. Thank you and my best wishes. Thank you all.